Okay. Okay, most of you already know me. My name is Dr. Mirza, and I work at Sheboygan Memorial Hospital for last few years. I skipped 1 year in between. So now I'm very much into preventive diseases, and my favorite one is DVT and the blood clots going into the lungs, which is called PE. I'm the president of Travel Medicine Corporation, and the force behind that is I want to make sure we can prevent most DVTs in the world, and I already started working on it. So right now we'll not talk about my company, we'll talk about the DVT and the pulmonary embolism. Next slide. Okay, I always tell my audience, please consult with your doctors. Do not take this talk as your treatment plan if something happens, because it's a liability issue. This is for education purpose. Next slide, please. Okay, so DVT, which is deep venous thrombus, and the pulmonary embolism, which is PE. Most people do use DVT and PE terms if you Google it. So a lot of people are educated about it. It kills more people than breast cancer, AIDS, motor vehicle accidents combined together, and still DVT and PE is higher than all of the above. But we do not hear much talk about it. Mostly we have a breast walk, breast cancer walk. We worry about that, which is very important. AIDS, motor vehicle accidents, but DVT, PE has to be alerted, and people have to be educated about it. There are almost 2 million people who gets DVT, 600,000 annual deaths from PE. Actually, it is much higher than that. It is just the reported deaths, because many cases after surgeries, when they have a sudden death, we do not do any studies on it unless you get autopsies done. So people blame it was sudden MI, heart attack, and patient died with the heart attack. Many of them died because of actually pulmonary embolism. Now most patients with DVT and PE, if the right things are done, we can prevent their deaths. We have to prevent this blood clot to be formed in the leg, and if you prevent that, you can prevent the death. Next slide, please. So most PE deaths are sudden death. Pulmonary embolism is the third most common cardiovascular disease, because when you look at the cardiovascular disease process, or the #1 cause of death in the world and also in the United States is cardiovascular disease, which includes heart attacks, strokes. So PE is the third one in the list. That's huge. So you can imagine how common it is, and we do not hear much about it. It is a big concern for our whole society. If we do the right prevention things, we can prevent it. It's very easy to prevent. It's just that you have to know how to prevent it, and we will talk that in the end of the discussion. Next, please. So right now, what do we do to prevent DVTs? If you look at the 40 or 30 years back, most DVTs used to happen in the hospitals. People get hospitalized. Right now we keep them for 1 or 2 days for big diseases. Old days, if you have a congestive heart failure, you stay there for a few weeks in the hospital getting treated, getting better or not, you go home. And these patients used to get blood clots in their legs because they're not moving around. Now for last 15 years or so in the United States, there are protocols. So if you are admitted to the hospital, we prevent the blood clots by using different devices in your legs, feet, also getting blood thinner injection in your tummy every day, so your blood stays thin, so you don't form a clot. So that issue is resolved, or almost resolved. Now we are dealing with most DVTs out of the hospitals. So now most DVTs happening because of different reasons, which we'll discuss. The cost of DVT treatment and the PE treatment is around $30,000. This is the plain cost. It's not the cost with somebody who have complications or some major event happened because of the clot. So this is a plain cost, which is very expensive. So if you develop some complication from the treatment, cost can go much higher. It can go up to $100,000, $150,000, depend what complication you had. If you had a bleeding from the blood thinner, which you're getting treatment of choice due to your DVT or PE, then depending where the bleeding is, if the bleeding is in the GI tract, in your intestine somewhere in the gut, then you will require procedures, will cost you money. You will require images, which will cost you money, and then the treatment to stop the bleeding. And if it happened in the head, that's the worst one. So it depends what happens with the treatment. And these treatments, complications can be life-threatening, because if you bleed from the warfarin in your head, you can die. It's very simple. Or you had a fall and you had a internal bleed, and you can die with that because of low blood pressure or ischemia or stroke to the brain, since the blood flow is not going there. So please, thank you. Who is at risk for DVT, which leads to pulmonary embolism, PE? Almost anybody is on risk for DVT, because if you are a frequent travelers, if you are sitting in your office for a long time. I was working in another hospital last month, and one of the ER staff girl, I have to admit, and why she came, because she was having chest pain for the last 3 days, and she's young. She's like, I'm not going to have a heart attack, so why I'm having chest pain? She came to the hospital. One of the blood tests was slightly positive for having heart attack. She came up to be admitted for possible heart attack. After I did her history, talking to her, I discovered that she doesn't move around at all. She has a desk job in the ER, and there is no other risk for heart attack. So I started working her for pulmonary embolism, for the PE, and guess what? She has a huge PE which was putting pressure on her heart, and her heart was releasing enzymes to look like she's having heart attack. So just imagine, the treatment is the most important thing. The timing is very important when you treat pulmonary embolism. If you are going to delay that, you're going to die, because you're going to put so much pressure on the heart, and you think you're having heart attack, but you're dying with the clot in your lung, which is blocking all the blood circulation. So she had a PE. So somebody who's sitting more than 2 hours straight, they will have a DVT, and eventually that will lead to blood clot. And that was another reason for me to come up with the idea of having, why should we prevent blood clots? Because I used to do clinic, and almost once or twice a month, I used to find patients who are truck drivers coming with leg swelling, and sometimes no leg swelling, just the pain, and end up having a blood clot in the leg, because the truck driver, they're driving long hours without stopping, some of them. So other reason could be if you have a family history of blood clots. That's very important, because if somebody have a history of in the family with blood clots, they are always at risk of having blood clots, either because they are carrying the gene which can cause the blood clots, or they're just prone to it. Most of the time we do find the gene, which is a very simple test to do, and usually we do it if somebody is young coming in and you don't find any other reason, you check for the gene, and there's some other reason which I will discuss. Young girls or middle-aged females who are not menopause yet and they are taking oral contraceptives, they are definitely risk for blood clots if they travel. So, or if the female is a smoker, they are much higher risk for having a DVT compared to male who is a smoker. So DVT is a prejudice a little bit about that. So if somebody smokes and they take and the girl is taking oral contraceptives, much higher risk factor to have a DVT and blood clots in the legs. History of previous blood clots. If you have a blood clot once, you are always at risk for having another one. And unfortunately, if you have a second one, then you're going to be on lifelong treatment for blood thinners. If you're carrying a gene for blood clots, like I mentioned earlier, family history, and then you check if you have a gene, depending on what type of gene. There's two types. One is one part of the gene. One is you have out of 4 you have 2 parts of the gene. Then you have to be lifelong on blood thinners. Next, please. So more risk factors. Current diagnosis, or if you have a history of cancer. Now, my own personal experience, I have patients in the past that they came with the blood clot, and we have no reason why they have blood clot, and they are not in any category to have a cancer. And unfortunately, 6 months later, after 4 months of treating, their treatment is done with the blood clot, you stop the medication, 2 months later they have another clot. And then we start getting worried about it, why they're having clot. And you start working on it, and what you discover is they have a cancer sitting somewhere. So many times blood clot kind of a blessing that you find out, oh my God, the patient have a cancer somewhere. And the cancer is producing hormones, chemicals, which will lead to form a clot in your leg or in the arm and travel to the lungs. It can be anywhere, but most common places in the legs, because our blood pools in the legs and it doesn't move as much, it moves in upper extremity. If somebody is sitting, rest after hospitalization or surgery, people get leg surgeries done, knee, ankles, feet, any kind of surgery, and you're going home and you're not going to be moving around much. You're a big risk for having a blood clot in the leg again. Somebody who's office worker, like I gave you the example in the beginning, they are also big risk for having blood clot. There are patients in these days, old days we used to treat them in the hospital for everything. You need IV, you got to be hospitalized, you need to be on IV medications. Now we have a prolonged IV catheters, we send them home and they take antibiotics either at home or they come here. So if you have an IV line sitting in your arm for a long time and the blood start pooling around that tunnel inside, and that will form a huge clot there, and that's a huge risk, because blood in the vein again moves in one direction. If the valves are closed, it's not going to move, it back up the blood flow and you form a clot. So that's another reason. Anybody age more than 40, so almost everybody in this room except one person. So we are all risk factor for blood clots. People who have a heart disease and lung disease. No, it depends what kind of disease you have. This is just a generic term, because anywhere you have a heart disease where your blood flow is compromised, like congestive heart failure, or you have a lung disease where you have a COPD, chronic obstructive pulmonary disease with emphysema, smokers, their lungs are already expanded so much they do not recoil back. That affects their blood flow, and that will lead them to being risk of a blood clot. Next, thank you. So what are the symptoms or signs for DVT or PE? You can have one or both legs swelling. You can have a swelling in the arm also. It depends what is the cause of it, because if you are having a DVT or blood clot in the arm because of the IV line sitting there for a long time, then it is going to be in the arm. But if it is going to be because of prolonged sitting or other reasons, that's going to be in the legs. Most of the time it happens in one leg. Rarely we do see in both legs. It's very rare, but it does happen. And we do not know why it happens in only one leg though. Blood flow goes same way, but usually it forms in one leg. You can have a redness, you can have a pain in the leg, cramp, you can have all of the above or only one symptoms or one finding. Shortness of breath. When shortness of breath happens, then it's concerning, because that means the clot in the leg has traveled now and have reached the lungs. That's a big problem. You have a sudden onset of chest pain. Now, if the chest pain with the shortness of breath or without shortness of breath, it could be from the heart attack too, because the symptoms are same. For the PE, when the clot goes to the lungs, you get the same symptoms and sign whatever we get with the heart attacks. That's why it is very important as a physician or the person who's taking care of you in the ER or the first medical staff person going to take care of you to ask you the right questions. If the patient comes, they have to diagnose this early on so you don't misdiagnose this. Because study shows if you have a PE and you make it to the hospital, you're going to survive because somebody will pick it up. If even the first person missed it, within 30 minutes, 40 minutes, if they're not going to find something else, and no doctors are very much worried about the SU, so they're going to CAT scan you right to left anyway, so they will find out. And once you make it to the hospital, you make it because the treatment works right away. They put in blood thinner injections and it works. But if you do not make it to the hospital, then you do not. You make it somewhere else. You can laugh, it's okay. All right, so now if you're feeling hot in your legs, arms without cramps or with the cramps, that's also a sign. Because somebody who does not have never felt hot in his one part of the leg, and all of a sudden you're feeling it, there has to be a reason. So if somebody have traveled, Atlantic flight coming here and now develop the redness in their leg, obviously there's a reason. Feeling warm or hot in your leg, there's a reason, because the clot is start forming. Next, please. How do we diagnose that? Very easy to diagnose DVT or PE. When somebody comes to the ER with these symptoms or to the clinic, nowadays we have a very good test. It's called D-dimer test. It's one of the enzymes or chemical we check in the blood. If it is positive, that does not mean you have a blood clot, but that means we have to do further study to check if you have a blood clot in your leg or in the lungs or not. Now, if it is negative, then you're almost sure you do not have a clot. It's a very sensitive test. It is not specific because it could be positive with a million other diseases. But if it's negative, for sure you do not have a clot. So it's a very good test to rule out. So if it is positive, what do we do? Then next step is depending on your symptoms. If you're coming only with the leg swelling, then we'll probably go ahead, just get the ultrasound done in the leg and find out, okay, he or she have a blood clot, start treatment right away. If there's no leg swelling or you have a leg swelling and shortness of breath, then the next test will be depending on your kidney function, what kind of test your body can handle. So we will do CAT scan, which is the most common test. Very common, most ERs do CAT scan unless you have a kidney problems. If somebody have a kidney problem or their weight does not allow to go these patients on the CAT scan machines, because we do not have a zoo CAT scan in our hospitals. So what we do is we do the VQ scan, which is a different test. We do not use much of the dye which goes to the kidneys. So so it does not damage the kidneys. So it's a different dye. It's a longer test, takes around 2 hours, 3 hours. What we do is if we suspect it's PE, we start the treatment anyway, because you can stop the treatment because you do not want to delay the treatment due to the test. And if VQ scan turn out to be negative, you just stop the treatment. Next slide, please. Now, how do you prevent blood clots? Very important. The most important thing to prevent blood clot in your leg is you have to stay active. Unfortunately, there are patients who cannot stay active because due to disease process, or they're going home after prolonged hospitalization, they're still not healthy enough to walk around. So for them, there are different options which we will discuss. Or if you are driving, take breaks at least every 2 hours. You have to get out of the vehicle, get out, you got to go for a walk, take a break, go to the bathroom. It's healthy anyway. So it causes your blood circulation to go up and you prevent the blood to pool in your legs. If you are in the airplane, try to stand up, move your legs, feet. There are different exercises. I have seen in some airlines actually, if you have long flights, because last year I had a international flight, so these Middle Eastern airlines are good. They actually give you exercises where you're sitting, how to move your feet to prevent blood clots. I was very impressed. So you do certain maneuvers and you can increase the blood circulation itself. There was a study actually last year. The passengers who take the window seat and the middle seat, they are prone to have more blood clots than the one sitting in the aisle seat, because these guys will get up, go to the bathroom, and the guys in the middle and the window, they are always shy to get up. All right, I'll wait for 1 more hour, what a big deal. So it is true, and there was a very nice study last year that people who are sitting by the window seat, they are more risk of having blood clots than the one sitting in the aisle seat. So patients with certain disease need to be on blood thinners rest of their lives anyway to prevent blood clots. So if you have 2 clots in the past, you're going to be on blood thinner rest of your life, because third one can kill you. You do not want to take a chance on that. And if you have a gene, you're carrying a gene which causes blood clot, then you have to also be on blood thinner rest of your life. And there are different procedures we do in these days too, that we make the surgeons or special doctors, they have these procedures. What they do is they go through a groin area and they put a small filter right by the kidneys. So any clot is formed in the leg, it will be blocked there, so it does not go to your lungs and kill you. It only prevents the death, which is very important, but it does not form the clot, it does not prevent the clot. To do that, they still need to be on blood thinner though, because sometimes they stop the blood thinners for procedures, so they cannot take a risk. So they have to have that filter there, otherwise they have a risk of dying any time with the clots. Next please. So now also patient with recurrent DVT, we just mentioned they need to be on blood thinner rest of their life. Now what other methods are used? In the hospitals, we do use everybody who get hospitalized in these days, they get sequential compression device. What is that? It is kind of a sleeve, it goes under both lower legs and it squeezes your blood. It just gives a kind of a massage, it goes in the rhythms and it never let the blood pool in your legs. So once the blood goes up, it keeps going, it never stops somewhere else. Okay? So that's the other reason to give this talk, is that there are compression devices now available in the market for people who will go home from the hospital and they are not moving around, or for people who have a long journey and they are flying for 8 hours, so they can use those so their blood keep going up and flowing, so they do not form the clot in the legs and preventing the PE. What else do we do to prevent DVT? We do use blood thinner medications. There is injection once a day, sub-Q, it's given in the hospital, anybody who get hospitalized. In these days when patients get home from hospital or they go to nursing home or rehab because they have a orthopedic surgeries done with the joint, hip, knee, they cannot move around much. For them, they also get either injections once a day or they get blood thinner medication for 2 to 4 weeks. So their blood stays thin, so it does not form a clot. Now we have a new product. We have a DVT pump available. This is the first ever DVT pump which is invented by Dr. Mirza, who's standing in front of you. So this will be coming in the market very soon. It's a rechargeable actually. People can use it in the car. Drivers should not use it obviously, because if they're driving they can, but they can take a break, lay down even, you are resting, and you can put in your arm or on the leg anywhere, and it will keep increasing your blood circulation so it does not form a clot. It could be used in the airplane. It's very small, portable, and it's like a small bag you carry with you. Next line please. Why this pump is unique? The one I'm not going to talk too much about the pump, but just to one slide. It is very unique because number one, we do not have anything like that to prevent. When we have over 600,000 deaths from PE, it's a big concern. I mean, if it's killing more people than breast cancer, AIDS, and motor vehicle accident, there's something need to be done about it. So it's very unique. It's compact, small bag, smaller than this bag sitting here, and you just carry with you, and the same bag becomes your sleeve, and there's a pump inside which you take it on the side, and it keep pumping your blood circulation, and it keep going. It has a unique feature of timing. It has 4 bladders in it. So let's say one area of the leg is getting discomfort or pain or sore, you just press that button and make that dysfunctional. So that area won't pump, and only the other bladder will pump. So this way it's working. The reason why I came up with that idea was in the hospitals, many times you go there and you see the patient in the morning, their sleeves are sitting on the side, pump is just sitting there, and they're not using it, and they're supposed to be using it. And when you ask them, they're like, oh doc, it was causing pain in my leg. So that's why we came up with the pump, which if you have a pain in the area, stop that area and keep working other areas, so your blood keep going. Now also you have a full control on your bladder for many things, not only for the sore area in the leg, also control of the timing. You don't want it more than 10 minutes. You want it every hour. You want it every 2 hours to keep running. You want to run for 5 minutes and then stop it. You don't want to expand too much. You want to expand less, the bladder, the balloon which pumps the blood. So there's a lot of unique things and simple things in that pump, so everybody can use it. Next, please. So if somebody is using this pump, it's very easy. You can use it in the car. You're going to long journey. You're traveling to other countries, or you're going to California from here, which is a long flight. You can take it in the airplane. It's a very nice size LCD on it, so you can see what part is functioning, and it also controlled by your own hands, time, venous pressure, and then it is not only for DVT. It is also for lymphedema patients. After breast cancer or after hip surgeries, they develop lymphedema, and these lymphatic channels not working, and they develop chronic swelling, and from that then they are always risk of developing cellulitis infections. And when that happens, every time infection happens in somebody who have a lymphedema, it just keep getting worse. So lymphatic channel get worse, and then the second time it get bigger, third time it get more bigger. So unfortunately, many times they end up getting amputations because they just cannot take it. So it's very useful for lymphedema too, because when this device was patented, it was patented for lymphedema, blood circulation, and the wound care, and it works for all of them. Okay, so treatments for DVT and PE. First choice is always prevention. It's easy to prevent. It's one of the easiest disease to be prevented, but it's very bad if it happens. Blood thinners, for a few months you have to be on blood thinners if you have a DVT or PE, depending on how big it is. Most studies do recommend from 3 to 6 months. Most doctors do though 4 months, somewhere in the middle. If you have a recurrent DVT or PE, you will need a filter to be placed, which I mentioned earlier. They usually places by the kidneys, so blood clot does not travel to the lungs. And then you also need to be on blood thinner rest of your life. In hospital setting, first we do the blood thinner injections because it works right away. Then for a few days you are on oral medications. You take a tablet, and your level need to be monitored with the tablet, because warfarin or any other medications, not all of them you need to monitor the blood level, but warfarin you have to. It's cheap, so most insurance cover that anyway. The other ones are very expensive, but you do not need to monitor your blood thinning levels. Next, please. And that's it. It's a question.